at this point, there is a fairly clear and persuasive evidence that masks do help both reduce the spread of the virus from people to each other and also reduce the viral load according to the theory of viral inoculum. And so certainly where social distancing cannot be maintained, which is obviously easier to do in the country than it is on an LRT vehicle, but quite frankly, in a busy suburban grocery store, whether it's in St. Albert or whether it's in Edmonton, it's one metropolitan economy. It's one labor market. It's one commuter shed. And the challenge is for the city of Edmonton to have to make this decision just for the city of Edmonton leaves open the possibility that a neighboring municipality might take a different measure, which could in the short term be bad for businesses in our city. And our Chamber of Commerce has called quite clearly for a mask mandate to remove ambiguity for businesses and equip them to maintain a stronger barrier of safety for their own workforce and for the continuity of their business, which we know is critical to our economic recovery. And so I still believe that at least at a metropolitan scale, this decision should be taken. I also think this is a public health measure, not a community standards measure. And public health is, we're all becoming sort of amateur public health experts here, but unlike municipalities in Ontario, municipalities in Alberta don't explicitly have that mandate, and we don't explicitly have that expertise. That said, if it falls to us, we will make that. We'll make a decision tomorrow. I don't know where the votes will land, but it sounded from the debate the other day like there was widespread council support based on widespread community support, based on widespread business support. And I hope that we won't wind up with a situation where an outbreak is traced back to a suburban grocery store in one of the outlying communities around us because the big city took the step and the bedroom communities didn't. That said, it sounds like from the conversations with the mayors that they're all looking at this closely, that most, if not all, of the transit systems will follow our direction and lead on this. So to the extent possible for clarity and consistency, certainly for regions of the residents of the Edmonton metropolitan region, I think a consistent approach would be best. Again, I would ask, but I think we know the answer, that come from Dr. Hinshaw or at least from Chris Sikora, the Zone Medical Officer of Health. But again, if it falls to cities, we'll take action to protect the economy and protect lives.